Hello and welcome to another edition of the Ask Dr. Pickel show, and I'm Dr. Jason Pickel. I practice functional medicine and I'm also a board certified chiropractic neurologist. So I want to go over some things today that again are pretty important, and especially since we've been on the topic here lately of low thyroid, Hashimoto's. This will give us a little more information here, especially as it relates to thyroid. Or low thyroid, or sometimes even high Hashimoto's, and the connection to the brain. How is that connected? How does my brain and my thyroid work together? So pretty interesting stuff here, at least from my point of view. So, the thyroid as we know it, and as we've discussed before, when you have Hashimoto's, well, let's say first if you have low thyroid. If you have hypothyroidism, your thyroid, of course, is not making enough hormone. Sometimes it's due to your thyroid, and that's called primary hypothyroidism. Sometimes it can be due to your thyroid hormones not getting from point A to point B due to something else going on in your body, which is more of secondary hypothyroidism, which also can fall into, is my brain signaling my thyroid to make hormone, which can be caused by the hypothalamus or the pituitary gland. So there's quite a few things that can cause low thyroid problems. And another one of those is called Hashimoto's thyroiditis, where it's not really a thyroid problem, it's an immune system problem. The immune system is attacking the thyroid gland or attacking things within the thyroid gland, and this is causing malfunction. And the person can get low thyroid symptoms, or they can get high thyroid symptoms. So we can get a combination there. It depends. If your immune system attacks your thyroid, that can cause you to get the thyroid inflamed, and then we can dump more hormone into the system, and suddenly I have hyperthyroid symptoms. If the Hashimoto's calms down, the immune system calms down, now my thyroid it's still probably inflamed, but it's not functioning very well, so I make less hormone. So again, I go into that hypothyroid state, which can be confusing sometimes for doctors because they're trying to prescribe your thyroid hormone and they keep having to change your dose. So again, not a good thing. And the thing that they'll typically look at on your blood is they'll look at TSH, which is thyroid stimulating hormone, and your T4. And what they'll commonly say is, hey, as if your TSH is high, I'm going to give you more hormone. If your TSH is low, I'm going to give you less hormone. Actually, textbook, you're not supposed to prescribe thyroid hormone based upon a TSH number. You need to look at the hormones. What is the T4 level, especially free T4 if you're on thyroid hormone. And then also commonly not looked at are the rest of the thyroid hormones, which we went into in a previous video. All right, so now the thing is if your immune system is affecting your thyroid, which is called Hashimoto's thyroiditis, Hashimoto's, again, isn't, like we said, it's not really a thyroid problem. What we find more in the research is it's more of a global issue throughout the whole body. And can it affect the gut? Yes. Can it affect the immune system? Yes. Can it affect other areas of the body and cause other symptoms? Absolutely. And one other important area it can really affect is the brain. And in fact, in the research, it's extremely well documented. In fact, they have a name for it. It's called Hashimoto's encephalopathy. In fact, you could even say Hashimoto's encephalitis too. Now, what is encephalopathy? Encephalopathy means we have some sort of pathology in the brain. We have some sort of problem in the brain due to the Hashimoto's. So, or if we even use the term encephalitis, that would mean inflammation of the brain. So either of these can kind of fit into that category. So just like gut inflammation and brain inflammation go together, Hashimoto's and brain inflammation can go together, which Hashimoto's tends to encompass gut inflammation also. So let's dive into a little more information about this. And in fact, let's go over to this. All right, let's kind of look at a couple of things here. In fact, let's make this the whole page here for a moment. Okay, so first we talk about Hashimoto's, or thyroid which is inflammation of the thyroid. Okay, that's kind of what you may have going on, someone you know may have going on. It can definitely be a problem. Now, there's a few things that can occur with this, because when you have Hashimoto's, you're going to activate basically nerve inflammation, or another word for that is neuroinflammation, because it can affect more than just the nerve cell itself. So then, if we get nerve or neuroinflammation, what happens at the level of the brain, which is made of neurons mainly, which are brain cells? Now, there's other cells in the brain too. And these other cells are called neuroglia. And you don't have to get into the wording of this, but these are just other types of cells in the brain. And there's one type of these neuroglia. It's called microglia. I'm going to write that here. Now, when you think of microglia, think of them as little Tasmanian devils. These are immune system cells in the brain. They basically, if they see something going on inflammatory in the brain, if they see something, see if I can switch this back. If they see something inflammatory in the brain, if they see something that doesn't look normal in the brain, they're going to attack it. The problem is when they attack something, they don't just go specifically to that one little cell and get rid of it. No, they kind of hit a big area at the time. It's like a little bomb going off. And they say, hey, let's get rid of this right now and destroy it. And this is what these microglia do. So if you are activating these microglia, yeah, this can start to cause some destructive processes throughout the brain, especially if a lot of these microglia start to upregulate or get activated, which we don't want. And of course, if that happens all the time, this starts to affect the blood-brain barrier. So the blood-brain barrier, this is basically it's a wall. Let's say it's a wall between your brain and the rest of your body, because what's in the rest of your body shouldn't go to your brain. And even immune system cells. Immune system cells in the rest of your body are different from the immune system cells in the brain. And we don't want those immune system cells crossing that blood-brain barrier. We also don't want certain chemicals or toxins or infectious agents crossing into the brain. So this wall, this blood-brain barrier, is pretty darn important. And again, if we have chronic inflammation in that brain, chronic attacks from the immune system, suddenly we can breach that blood-brain barrier. It can become leaky. Just like you can get leaky gut, which is really an immune system problem, you can also get leaky brain, they call it. So, and if you get leaky brain, not good. This can really cause a lot of neurological type symptoms, which we're going to go over here in a minute. So another side of this that comes into play is if we're activating these microglia, if we're getting neuroinflammation, this starts to cause neurodegeneration. Now, degeneration means breakdown, destruction. Over time, we get some degeneration in our body, our brain, but this can get accelerated. And if you see this in a younger person, then it's like, hey, wait a second, they're too young to be having neurodegeneration. Now, and many people can have premature degeneration where the doctor may do an MRI of the brain and say, hey, the frontal lobe looks a little smaller than it should. No big deal, though. But hey, this could be a product of neurodegeneration. The brain's degrading faster than it should. And we definitely don't want that happening. So what are other things that can happen too is if that immune system continues to be activated, and especially with Hashimoto's, we have TPO antibodies And remember, because there's two types of antibodies that you look at with Hashimoto's. One of those is the TPO antibodies, and the other one is the thyroglobulin antibodies. And again, you can have either one of those, or you can have both. But these TPO antibodies, along with another interesting thing in the research, gluten sensitivity, which is about 99.9% of people who have Hashimoto's. If those two things are in play and suddenly you get everything inflamed, what's going to happen is that these two things look just like, oops, cerebellum tissue. And then we get cross-reactivity. Now, cross-reactivity, that is like, again, if you have a cross-reactivity of a food. So you could be, let's say you eat let's say you have a gluten intolerance and you eat some dairy or some soy. And those look very similar to the immune system. So they can cause the exact same reaction. They're called cross-reactives. So these are things that your immune system says, hey, that looks a lot like that. Maybe we should attack it too. And it will do this. And so these TPO antibodies, these gluten, these can cause the immune system to upregulate or increase its attack, let's put it that way. And then also your brain, your body will say, or your immune system in the brain will say, hey, you know what, that looks a lot like the cerebellum. Let's attack that too. And we're going to talk about in a moment the consequences of this with the cerebellum. We'll talk about symptoms and things like that here in a minute, because it's like, what is the cerebellum? What does it do? We're going to get to that. All right. So another factor here is, let's go this way with this. Now, also, if we start to affect nerves and get nerve inflammation, then we can start to get neuropathy symptoms, which that's not really just the brain. Now, that could come from the brain, but also this means it can affect our peripheral nerves. Now, another thing that can happen too is with the thyroid getting inflamed, we get impaired, decreased thyroid function. Then if we have those things going on, what happens is we can get impaired plasticity. And I don't know if any of you have heard of plasticity. If you've heard of plasticity, oops, 1 second here, a little technical glitch. Of course. Okay, 1 second. All right, if you've heard of neuroplasticity, raise your hand. You don't actually have to raise your hand. But neuroplasticity, this is the brain's ability to change and model itself with learning, or if something happens in the brain. We want that brain to be able to become plastic, meaning it can change kind of what it does. Maybe you've heard of a big example of this would be like if somebody lost hearing in one of their ears completely. The hearing in their other ear may actually become better. Hopefully that occurs. Or some people that become blind, they lose their sight. Maybe they had a trauma and they lost their sight. Then they may start to get increased hearing, increased smell, increased taste. Some of the other senses can start to increase. Now, plasticity doesn't just have to be that, but this is kind of a rewiring of the brain. We want our brain to be able to rewire. If you're, let's say you're practicing baseball and you're throwing the ball over and over and you're trying to get better, you're practicing regularly, the brain starts to rewire. It starts to become more efficient. Those pathways become more efficient and you get actually better at what you're doing. That's plasticity. So if we impair plasticity, if we're not allowing plasticity to occur properly, yeah, not a good thing. It means you can't really learn new things. It means your brain isn't able to do these things properly. All right. So what's another thing that can happen is we can start to get decreased synaptic activity. Wait, I see writing here. Okay. So what does that entail? Synaptic activity. What the heck's that all about? That means it's affecting our neurotransmitters. Remember, our neurotransmitters communicate between all the brain cells communicate with these little neurotransmitters. It's our brain chemistry. So this can start to affect our dopamine, our serotonin, our acetylcholine, and our GABA. Now, there's actually a lot more neurotransmitters, even the ones that they don't even know about in the research, or really aren't able to describe. So, but again, these main neurotransmitters can easily be affected. So this can equal a lot of symptoms too that we're gonna get to. And there's also another interesting factor here too that can come into play is we can start to alter growth factors. So growth factors, well, does that have to do just with when you're going from kid to teenager to adult? No. We need these growth factors for plasticity. We need these growth factors for growth and healing of things in our body. It's pretty important that we have certain growth factors like growth hormone, things like that. And basically, as nerve cells die off, we need to regrow new ones. And so this, of course, can also cause impaired plasticity. Okay. So we've got quite a few things happening with Hashimoto's in the brain and this interaction that really occurs here. Let's see if we can switch back here. All right. So, we got to say, okay, but then what's this doing to the brain? What symptoms would help me to understand how this is affecting my brain? Because I can say, hey, this is affecting this is affecting this. The immune system is not only affecting my thyroid, but it's actually potentially attacking my brain. How does this tie in? So let's kind of, with a reference here, show you the brain. And this would be a side view of the brain. And here's just the main lobes of the brain. It's definitely a lot more detailed than this, but this kind of gives you a generalization. So we have the frontal lobes in the yellow, the parietal lobe in the blue. I'll explain the frontal lobes here in a moment, or some symptoms related. Parietal lobe is your sensory cortex. This is like if you feel a surface, that's where you actually feel it or perceive that feeling, that texture in your brain. Or if you're walking through a doorway, this helps you perceive how to get through there without walking into the door jam. This tells us where we are in space. The occipital lobe in the green, this is your visual cortex. So anything that comes in visually is interpreted here. And this, of course, communicates with these other areas of the brain and tells them kind of what to do. The temporal lobe, this is in general, these are just some general functions. Temporal lobe typically is your auditory cortex for hearing, big memory area. Also deeper in the temporal lobe is a lot of emotional areas. And then we have an important area down here too, kind of in the brown, and it's called your cerebellum. And the cerebellum, pretty important for balance and coordination. And let's put it this way, 90% of the sensory information that goes into the rest of our brain goes through the cerebellum first. Sometimes I call it the mini-me brain. So it's pretty important. The cerebellum actually has a lot of functions, very important, it works. Now with Hashimoto's encephalopathy, in the research, the tendency is that it tends to affect more of the frontal lobe and the cerebellum. Now we kind of already talked about how it affected the cerebellum on that diagram that I drew, just because we get the cross-reactivity of the thyroid antibodies and the gluten sensitivity. So that cerebellum, it can be easily affected. And what happens if your cerebellum has problems? Well, that can really affect your balance and coordination. You could become ataxic, where it's, hey, my walk, I'm kind of off balance here. You could potentially even have dizziness or vertigo type symptoms with this. You could get sensory symptoms with this. You could get processing symptoms with this. There's a wide range of things that come in with the cerebellum. So pretty important area of the brain that we need working properly. Now, if we go to the frontal lobes of the brain, that yellow or gold area, let me talk about some symptoms that can go into this and see if you recognize any of these. trouble listening, distractibility, poor planning skills, boredom, lethargy, like kind of feeling lethargic or tired, lack of motivation, excessive daydreaming. Another interesting one is conflict seeking. These would be people who kind of almost look for conflict. Difficulty waiting your turn, restlessness, impulsivity. It's like if you're in the grocery store and you see something and when you're in the cash out line and they have all those little things there and you're like, I gotta have this, I gotta have this. You're impulsive. Talking too much or too little. Trouble sustaining your attention in just routine situations. An inability to give close attention to details. And this is actually a big area for planning, being able to establish goals and have forward thinking. Maybe if you have difficulty expressing your feelings, difficulty following through with things or getting things started, difficulty expressing empathy for others, kind of brain fog, being in a fog all the time, learning from mistakes, people who can't really remain seated if they're expected to. This can even happen in kids. Interrupting, blurting out things without really controlling that. And so we'll see sometimes diagnoses related to this. You like attention deficit area. This is frontal lobes. Obsessive or repetitive thoughts. This is the frontal lobes. Poor spatial orientation and especially working memory. This is the frontal lobes. Remembering directions or kind of getting lost easily. This is also the frontal lobes. But again, these frontal lobes communicate with the parietal lobe and temporal lobe. So they communicate in this. And also if there's poor social behavior or being able to interpret social cues like facial expressions, body language, if you can't interpret that stuff, it's frontal lobe issues. Recognizing objects. If it's like, hey, I see that, I just can't remember what that is. And then the thing that we'll also look at too is, can this affect one area of the brain over the other if we kind of put the brain together? So let's even say this. Let's say most of your problems are more left because we have a left side of the brain and a right side of the brain. If it's more of a left brain issue, now I know this is, I'm not really on the screen here. Let me, here. Well, all right. So if we get these left brain issues, because we kind of saw the brain there, if the brain is more an issue on the left or sometimes it's more an issue on the right, usually we have a dominant side. Everybody has this. But sometimes if it's inflamed more on one side than the other or having problems more on one side than the other, that's where we can really get the symptoms. So if it is left brain, we're typically going to get poor reading abilities, poor speech development, difficulty understanding words, like it's more receptive. It's like somebody's saying something to you and it's like, what the heck are they saying? Kind of this auditory processing, very important. Poor memory for facts and figures, unable to make calculations, lowered IQ. This is usually left brain. Verbal memory, remembering words, identifying objects. It's like, okay, I see that object, I know where it's at, but again, I can't identify it. Or focusing on small details. I can focus on the big picture, but I have a hard time focusing on the small details. That's left brain. Poor verbal communication skills. So then we've got right brain, which that's really going to be basically you're going to see more big, you're going to have trouble seeing more of the big picture. I may have put left brain, you're going to see the small side. Right brain, you're not going to be able to see the big picture. Right brain, you may see an object, you can identify, but you can't really make your way to it, or you can't direct yourself properly. A lot of these overlap quite a bit, and actually we'll see more of the attention deficit issues. Sometimes the OCD type issues will be more of the right brain. And in fact, some of the direction sense too, that can be more right brain. All right, so very important that we get these things working properly, that we get inflammation under control in the brain. Because if your Hashimoto's is affecting your brain, not a good thing. This is degenerating you quickly. This is causing breakdown early. And if you affect the neurotransmitter side, if you remember on that drawing, we talked about the synaptic side. Yeah, this will start to affect emotions. So then it could be suddenly this person's personality has changed. This person is showing more emotions than typical. And they can be specific for each neurotransmitter. And that's how we can kind of identify those. But so if you notice, hey, I'm more angrier than I used to be, or I'm more depressed than I used to be, these are signs of neurotransmitter problems, possible signs of brain degeneration. So again, if these symptoms are occurring and you have Hashimoto's, yeah, this is something that definitely needs to be controlled before it gets worse, before you get more advanced degeneration, because if it especially affects the frontal and temporal lobes, yeah, that's early dementia type symptoms. So, or there's so many other potentials for neurological issues here. And even when you relate in, there's some people who have thyroid issues and they have multiple sclerosis. Are they related? Is the issues occurring in the brain related to the thyroid? Absolutely can be. They're both autoimmune conditions. So we got to kind of look at it from this perspective. We got to look at the whole body. How does it all fit together? Not just one area at a time, because the doctor could just look at the brain and say, hey, your brain looks fine on the MRI. That doesn't mean it's not inflamed. That doesn't mean it's not degenerating. It can be occurring at a functional level, but not a major pathology level. You're not bleeding. You don't have a tumor. You're not going to show up for major pathology on an MRI. But again, that doesn't mean there's problems that aren't occurring at the brain chemistry level, at the neuron cell level. And some of these things can be helped by diet. Some of these things can be helped by nutritional supplements. Some of these things can be helped by detoxifying things out of the brain that the immune system's attacking in the first place. So we have to look at all these different things here. All right. I had a few comments come up. Someone said this is the first time they had heard about these things related to the thyroid. Absolutely. In fact, if you go to, let's say not Google, but Google Scholar, which is the research side of Google, you can type in Hashimoto's encephalopathy. You're going to find more research papers than you could ever read. I mean, I get updates showing encephalopathy almost daily. It's crazy on how it works. And then another comment, do I need to treat my Hashimoto's more with just than just synthetic hormones? So synthetic hormones, some people do better on synthetic hormones. Some people do better on natural thyroid hormones. It varies per person. Some people do horrible on natural thyroid hormones and they react. So, and some people again do horrible on synthetics. So we can't always, this is the thing, is it's not really about, does everybody fall into this box that has Hashimoto's? Because Hashimoto's is just a label. We have to treat you, the person, and not Hashimoto's. So, and that's really kind of our philosophy, treat the patient, not their diagnosis. So again, kind of hard to always say there, but yes, usually the thing is taking thyroid hormone doesn't help the cause of Hashimoto's. It may help bring in thyroid hormone because your thyroid's been destroyed to a degree that it can't make enough. But again, you still have to deal with the immune system issue, which is the cause of the problem in the first place. What's my immune system attacking? And how do we get the immune system calmed down? And then inflammation in the brain, yeah, many things. So usually by settling down inflammation globally in the body, the brain inflammation will drop. It's mainly, again, getting the immune system under control. We have immune systems in the brain, immune system in the body. It's getting all of that under control. And number one, to find out what the attack is about, because typically the immune system can be up. You could get down inflammation with medication, steroids, even supplements you can use to bring down inflammation in the body. But that's like you're trying to put out the fire, but the thing that's causing the fire is still going. And until you find the cause or causes, which usually is causes of the fire, then you can't really put it down, and it just becomes kind of this road to nowhere where it's like, oh, I felt better for a little bit, now I'm back to where I was. So you have to get rid of the actual causes. And number one, to get rid of them, you got to find them. And that's where, again, we have to look deeper than just typical tests. We have to go outside the box to look further for these bad guys that can live in the system, such as heavy metals, chemicals, infectious agents, things that can exist in your system that may not show up on a blood test, may not show up on a typical stool test, may not show up on some of these other tests that are done in conventional medicine. So, and that's why a lot of our patients have already been from, 5, 6, 7, 8, 9, 10 plus different doctors, and they're kind of at wit's end. And so they choose an alternative route, which is us. So again, and that's why we can't do what they're doing, because why do that? Because we would only get the same result and you wouldn't get better. So we have to go outside the box and look at this in a different way so we can try to find answers for you and get you from point A to point B. All right. I hope this information helped. I appreciate everybody watching. God bless and have a wonderful day.